Welcome to Road to Recovery Animal Hospital.
Hi, I'm Amy. I'm the veterinarian here at Road to Recovery.
Hi, I'm Lauren. I'm the circulating nurse here at the clinic.
Hi, I'm Maddie, and I am the anesthetist.
Today at Road to Recovery Animal Hospital, myself and the surgical team will be showing you the procedure of admitting, examining, sedating, inducing anesthesia, and preparing the patient and the surgical team. This is Cassie, a 6-month-old Vizsla who has come in for a spay.
As a circulating nurse in the clinic, my work includes receptionist duties. In order to admit our client into the clinic to have her spay procedure done, we require specific information and records to resume further in the process. Previous to today's surgery, I collected our patient's information from our owner, Sue. We also have emergency information on file in order to contact Sue in the case of an emergency during the procedure duration. Sue has been enlightened on the cost of the surgery, as well as the pros and cons of having it performed.
Positive benefits to having this surgery include lowering the risk of ovarian and uterine cancer, getting pyometra, and preventing overpopulation. Negative consequences of opting not to have the surgery include a higher risk of ovarian and uterine cancer, higher risk of getting pyometra, and overpopulation.
Prior to surgery, the patient should have a dietary restriction 12 hours before surgery to avoid vomiting. If Cassie vomits during surgery, she can risk choking and potentially dying. The night before, a small amount of water is permitted before bedtime. We have clarified that Cassie has been fasting since 9 p.m. the previous night before surgery.
We are going to bathe Cassie prior to surgery to eliminate the bacteria. We will also take her outside to eliminate before general anesthetics are administered.
Next, we will perform a surgical examination on the dog. Cassie's weight will determine the appropriate dosages of anesthetics to be given.
A thorough history of the medical records will be looked over. We will be checking specifically for drug allergies, as well as conditions such as asthma. It is vital to confirm that anesthetics aren't being administered to a patient that has a heart disease, in order to avoid serious side effects that could result in death. I'm going to go ahead and check Cassie for any diseases prior to surgery.
We're going to be doing a few simple examinations such as checking TPR, and hydration status. We want to ensure that Cassie is in suitable condition before proceeding with the surgery to avoid any complications from occurring. To check Cassie's mucous membranes, I'll first pull back her upper lip and examine her gums. Normal mucous membranes appear pink and moist. However, some breeds naturally have black pigment in the mouth and gums. If this is the case for your dog, check the tongue instead. Pale or white mucous membranes suggest a serious health problem that may be dealt with as an emergency, where immediate help should be sought out. While the upper lip is still lifted, locate the gum line above their teeth. Then press on the gum with your finger or thumb and then release. It is normal for the gums to blanch white. Return to its pink coloration within 2 seconds.
To check your hydration status, gently pinch the skin behind your pet's shoulder blades and lift it into a 10 shape, then release immediately. If the skin snaps back to the body within a second, your pet is likely suitably hydrated. Over a second to snap back suggests that your pet may be dehydrated. Dry, sticky, or tacky feeling gums can signal dehydration, also potentially an issue of serious concern. Always use a digital thermometer to measure the rectal temperature of your dog. It is more accurate than any other method. First, lubricate the end of the rectal thermometer with either a water-soluble lubricating jelly or a petroleum jelly. Next, insert it into the rectum. Pause for the recommended amount of time by that particular thermometer, remove it, and then view the results. A normal temperature for dogs is between 100.5 and 102.5 degrees Fahrenheit.
To check the heart rate, position the pet into lateral position, preferably laying the pet on its right side. Place your hand on the pet's chest just behind the shoulder blade to feel for the pulse. Count the heartbeat for 15 seconds and then multiply that by 4 to get 1 minute. The normal heart rate for a dog should be between 80 and 150.
To measure the respiratory rate, have your pet laying down in a relaxed position. Observe the rising and falling of the chest. Count the number of breaths for 1 minute. The normal resting respiratory rate for dogs is anywhere between 24 to 42 breaths per minute.
I'll now be giving Cassie propofol through an intravenous injection. I'll be giving this injection in the cephalic vein.
I am inserting an endotracheal tube.
She is now adjusting the settings on the SpO2 monitor using the appropriate ratio.
She is shaving Cassie in the abdominal region where the incision will be made during the surgical procedure. She's cleaning using a chlorhexidine formula, scrubbing in a circular motion, starting in the center, in order to eliminate bacteria and to remove dirt and debris. She is disinfecting using an iodine solution. She is bringing Cassie into the surgery room and placing her onto the surgery table in dorsal position. We can place a heating pad underneath Cassie to keep her warm, as well as put socks on her feet to keep her from losing heat.
Now preparing ourselves to enter the surgery room. I am non-sterile.
I am non-sterile.
I will be sterile. We're going to pursue with Cassie's surgery.